Winchester Medical Center has implemented a new forensic examiner program. At the heart of this program are the forensic nurse examiners, or FNEs. These nurses are trained to examine and collect evidence from victims of sexual assault, as well as from the perpetrators. Their experience and training also qualifies them as expert witnesses in a court of law. Forensic nurses are part of a team. The team consists of law enforcement, social services, the victim witness program, and rape crisis counselors. When a sexual assault victim comes into the emergency department, they are taken to an examination room. If the patient needs immediate medical attention, they are seen by the attending physician. The forensic nurse and a rape victim companion are also immediately notified. Law enforcement or others who have accompanied the patient are taken to a quiet area away from the staff and other patients. This is so no one will overhear any details of the assault which could violate patient confidentiality or disrupt the integrity of the investigation. Law enforcement officers are not permitted to discuss the assault with anyone other than the FNE or the patient's physician.
It's very important for us to protect the confidentiality of the patient.
When the FNE arrives, she first introduces herself to the patient and takes a brief history. If the police have not been notified of the assault, that is done. It is explained to the patient that reporting is not the same as prosecuting. A rape victim companion will also be with the FNE. These women from the Shelter for Abused Women's Sexual Assault program are trained to provide crisis intervention and emotional support to victims. They are patient advocates and provide support in the emergency department. They refer patients to the sexual assault program for follow-up counseling and support throughout the legal process. The rape victim companion enables the forensic nurse examiner to collect evidence while still remaining objective. The first thing the FNE does is obtain consent from the patient to collect evidence and take photographs. She explains all the procedures and their importance. The patient is informed of their right to refuse any part of the exam. After the consent forms are signed, the FNE interviews the patient. Using the patient's own words, she writes an account of the assault. This narrative is crucial because it guides the forensic examination. Once the narrative and physical assessment are done, the FNE collects the physical evidence. Bodily injuries are documented, photographed, and diagrammed. The FNE does not leave the room once evidence collection begins, and no one else will be permitted to handle the evidence. The emergency room physician is present only to supervise the internal exam. All biomedical and trace evidence from the exam are put into the physical evidence recovery kit. This evidence is used to establish if intercourse occurred and with whom. Injuries of non-consensual intercourse are often difficult to detect. Specialized equipment and techniques are used to collect the evidence. A Woods lamp is used to identify semen stains. The UV light causes certain material to become excited and visibly fluorescent. Semen, some detergents, and certain clothing fibers react. The Woods lamp is used in the collection of specimens from the patient's body and to identify areas of fluorescence on clothing. Photomagnification by the Medscope is used to document injuries. Equipped with a VHS recording system and video printer, the Medscope uses a fiber optic light source to reveal injuries. Areas of documentation include external genitalia, vaginal wall, and the cervix. Toluidine blue dye is used to help detect injuries of non-consensual intercourse. This dye adheres to special cells which rise to the surface following trauma. Photos are taken with the Medscope before and after the dye is applied. Even though these are excellent techniques, they do not prove consensual or non-consensual intercourse occurred. They do, however, help to establish whether or not the patient's statement is consistent with the evidence collected.
Do you see anything? Yeah, I do. I mean, there's some small
The evidence collection process can take up to 4 hours to complete. This is obviously very difficult for the patient, and care is taken to help her maintain a sense of security and control. Once the process is complete, the evidence is carefully packaged, labeled, and turned over to law enforcement. The chain of custody is both documented on the PERC and the patient's medical record. The FME will discuss with law enforcement pertinent details of the exam. They are also given copies of the forensic exam documentation.
She did have some writings and everything, but
The forensic documentation does not become part of the patient's medical record. It is kept in the emergency department and is accessible only by the FNEs. The patient is given the option of being treated for sexually transmitted diseases. If she is not pregnant, she is given an estrogen pill which will prevent pregnancy. If she is given an injection, she must stay in the emergency department for an additional 20 minutes to ensure she will not react to the medication. Before the patient is discharged from the hospital, she is given the opportunity to shower, brush her teeth, and is given new clothing provided by the Shelter for Abused Women. She is given information about services within the community, such as the shelter, victim witness, and the health department. Sexual assault has been called a silent, violent epidemic. It devastates its victims and their families. A successful forensic nurse examiner program will allow for a unique partnering of the nursing profession, law enforcement, victim services, and forensic medicine. Its success will allow us to reach the common mission of providing the highest quality care to victims of sexual assault.